T. Hmm? Hmm? Hmm?
Any volunteer?
Can I
Any
take it?
volunteer in the case?
Okay, can I take it?
دكتورة غادة.
Yes.
Okay, طيب. I will send the scenario in the chat box so all of you can see it.
Okay.
Okay. This is the scenario. 30 years old, Mr. Hatim, who comes to you with right joint pain. Dr. Ahmed, please mute. Please mute, Dr. Ahmed. Okay. Scenario clear for everybody? Right knee joint pain. Right knee joint pain. Right knee. Mr. Hatim, 30 years old, who comes to you with right knee joint pain. Right knee joint pain. Okay? Ready, Dr. Ghada?
Okay.
Right.
Start.
Let me just adjust the time for you. Let me adjust the time. Okay. Start, Dr. Ghada.
Hello, I'm Dr. Alice, doctor in the medical clinic today. Am I talking to is being asked to talk to you and to examine you. Is that okay with you?
Yes, it's okay, doctor.
Mr. Hatim, I came to know that you have trouble with the right knee pain. Would you tell me more about that?
Yes, doctor. Actually, I have started feeling this pain since the last 2 or 3 weeks. And actually, it's very severe, and it's actually limiting my movement.
Sorry for that. Is this the first time to have this pain, or you had before?
Actually, I was having such a pain before, but now it's becoming very progressive.
Sorry for that. Would you tell me more about the previous attacks?
No, it was not that attacks. I didn't seek any medical advices. But for this time, I feel that it's really hurting me and it's limiting my movement.
Sorry for that. Is it swollen?
Sometimes, yes. Sometimes.
Okay, can I have a look?
Yes, you have a look. You can see the joint is a little bit swollen. And that's all, no erythema.
Okay. Any other joints involvement?
Sometimes I feel the same pain in my left knee. Sometimes.
The left knee. Any pain in your toes at all?
No.
Any trauma to your knees?
No.
Any high body temperature?
No.
Okay, well, any medical condition I should be aware of?
No, doctor, but actually, I came just 1 month back. 1 month back. Okay, just because I started to have just a little bit vision problem. My vision is not okay. I came to the eye doctor and he checked my vision and he gave me these glasses.
Well, was it red and painful?
No, it is not painful.
What was the problem exactly with your eyes?
I don't know exactly, doctor, but he provided me these glasses and he told me I might need an operation later on.
Do you have any, laxity of your joints, frequent dislocations or something like this?
Yes, doctor, yes.
Any skin changes at all or skin rash?
No, I don't have skin rashes, but I have noticed that my skin is becoming very thin. As you can see, I will show it to you.
Okay. Do you have any loose motions?
This is the skin.
Okay. Any loose motions at all?
No.
Do you have any change in your water work?
No.
Okay. And what about your performance in the school? Are you doing well?
Yes, it was okay, doctor.
Okay. So I just want to. Do you have any problem with? Do you have any problem with joints, like frequent joints dislocation?
Frequent joint dislocation? Yes, sometimes, especially in my shoulders.
Okay. Any family history of similar condition?
I don't know, doctor. I'm adopted.
And are you taking any medications?
Medications? No, only over-the-counter medication. I take only ibuprofen.
You take ibuprofen? Okay.
Yes.
And okay. And I want to see if his examination. Can I examine you?
Okay. What do you want to see?
I want to see his height. How his long is proportionate or
Height is okay.
height? Yes.
It's okay. 170.
Sorry.
170 centimeters.
Hello.
170 centimeters.
170 centimeters. Okay. And this arms to length to his
What
height.
do you want to see?
I wanted to see if this proportionate long arms.
Yes. No, it is proportional. He's not long. It is proportional. 2 minutes remaining.
Okay. Sorry. Yes. Just a few questions. Do you smoke?
No.
Well, do you drink alcohol?
No.
Do you drive?
Yes.
Yes. At this moment, I just if the eye problems affecting your or causing you problem, just stop driving until we update you regarding this issue. I want to examine a chest, the vascular system for any aortic regate.
Yes, there is an early diastolic merman in the second aortic area.
Yes. Any bony deformities, especially in the long bones?
No. Bony
Examination of the
deformity?
knee.
Where do you want
Yes.
to see?
In the legs?
Legs?
Yes.
Okay, let me show you.
Hmm? May I know what's your concern?
This is the food.
Okay. This. May I know what's your concern, please?
I want to know what's happening with me, doctor.
Yes, from what you told me and after examining you, yes, before that I highly appreciate your concern. It seems that you have osteogenesis imperfecta, in which there is it is a familial condition in which there is problem. Actually, there is also other possibilities, but the most likely in which there is bone. The bone is not well formed. Just
Okay, time finished, doctora.
Yeah.
Time finished. Okay. What is the positive finding in the history and in the examination?
Positive findings in the history: joint pain, recurrent joint pain, recurrent joint dislocations. Also, in the examination, he has swollen knee.
Okay.
He has deformed big toe in the left, in the right foot. Okay.
Okay.
He has very thin skin. Virus.
Okay. What else?
He has very thin skin. Okay. This is a positive findings in the examination. I have to ask about the sclera. I should look for blue sclera. Tries to differentiate between ehlers-danlos and osteogenesis imperfecta. But as he has no long bone deformities, I think ehlers-danlos syndrome will be very differential diagnosis.
Okay. How do you want to approach this case?
Yes, we do first investigations. We do knee and multiple joint imaging, X-rays.
Time finished. Time finished, doctora. Time finished. Thank you very much.
Thank you.
Please mute. I would like just to tell everybody, if anyone knows the diagnosis, please do not write it in the chat box unless we finish the case and we can discuss it together, okay? I think one of our colleagues wrote the possibility. Okay, I'm going to discuss the approach for the sake of the time. Dr. Gada, you said you took a long time. You did several mistakes, Dr. Gada.
Yes.
Okay, and first of all, okay, you have to respect the patient's concern. Okay, you have to start with the patient's concern first. Have you started with the right joint, examining the right joint properly?
Sorry, yes, I did this.
Yes, first of all, you have to start. Yes, you have to start with the joint pain first. Examine the joint pain. Examine the joint, okay, for any tenderness, for any swelling, for any erythema, and have a look over it, okay, with the active and passive movement, etc., etc. This is number one. Number two, I think you took a long time in the analysis of the joint pain. As I have told our colleagues previously last week when I discussed this case, actually the case is Ehlers-Danlos syndrome. Ehlers-Danlos syndrome. Okay? First of all, when you face any case with joint pain, there is special questions you have to ask so at least you can limit your differential diagnosis. You ask the key question, by the way, but you ask it very late, Dr. Agada, which is, Have you noticed any laxity or hypermobility of your joint and your skin became more elastic or not?
Which one?
Ask about laxity of the joint first of all. Before asking, is it painful, is it stiffy, is it, ask about this.
Okay.
Have you noticed your joint became more extensible or having more laxity than usual? He will say to you, yes. Okay, next question. Have you noticed that your skin became...
Come on, I made sure you go. Wow.
Mute, please, mute.
Well, I saw something like this before.
Okay, pardon, I will mute all of you and then we can, after that, I will let the questions, okay? First of all, ask about this laxity of the joint and elasticity of the skin. If the patient tells you, yes, I have noticed that my skin became more elastic and I have noticed that my joint became more laxity than usual, so your differential diagnosis will go to, in this basis, you have to concentrate upon 3 differential diagnoses: Ehlers-Danlos, Marfan syndrome, and pseudoxanthoma elasticum. Okay? Okay, if the patient tells you that, no, I haven't noticed anything, so after that, the next question, it should be, is there any stiffness or not? Because if he tells you there is no stiffness, your differential diagnosis will go to the mechanical causes. Mechanical in addition to infectious and crystal-induced arthropathies. I mean, in the mechanical, mainly osteoarthritis. In the crystal causes, mainly gout and pseudogout, and infectious causes like septic arthritis and trauma. These are the causes of non-stiffy joint pain. If he tells you that, yes, I feel stiffness, so the next question after that, for how long do you feel stiffy? Is it less than 1 hour or more than 1 hour? Because if it is more than 1 hour, usually this one goes with seropositive arthropathies. Seropositive arthropathies. And if it is less than 1 hour, usually it goes with seronegative arthropathies and Behçet's disease. So, to concentrate it again, first of all, ask about laxity of the joint and elasticity of the skin. If yes, this goes to Ehlers-Danlos syndrome, Marfan syndrome, and pseudoxanthoma elasticum. The patient tells you no. The next question, is there any stiffness or not? If he tells you no stiffness, so your differential diagnoses will be narrowed into mechanical causes like osteoarthritis, infectious causes like septic arthritis, trauma, and crystal-induced arthropathies like gout and pseudogout. And after that, you can ask targeted questions to reach your diagnosis. If he tells you, yes, I have a stiffness, next question will be, for how long do you feel this stiffness? Okay? Is it more than 1 hour or less than 1 hour? Or you can ask another question. For example, if you don't want to ask about stiffness, you can ask about, is this joint pain improves with rest or with movement? So you can list at the differentiate between inflammatory causes and non-inflammatory causes. Okay? It is not a fixed approach, guys. It is not a fixed approach. Just choose the approach that will be very suitable for you, and choose the approach which is very suitable for you. Okay? I personally, I like this approach. Okay? Is there any stiffness or no stiffness? Yes, there is a stiffness. Okay. Next question, for how long is this stiffness. More than 1 hour, usually this goes to seropositive arthropathies like rheumatoid arthritis, SLE, Sjogren's syndrome, systemic lupus, dermatomyositis, polymyositis, etc., etc. All the seropositive arthropathies. If it is less than 1 hour, usually this goes to seronegative arthropathies like reactive arthritis, ankylosing spondylitis, psoriatic arthropathy, enteropathic arthropathies like inflammatory bowel diseases, and Behçet's disease. And after that, you can ask targeted question. Okay, our patient here is supposed to tell you that, yes, I have noticed that my skin became more elastic and I have hypermobility or more laxity of my joints. And you already asked Dr. Ghada, have you noticed any recurrent joint dislocation? I told you, yes, I have noticed that, especially in my shoulders. Okay, so after that, you go and narrow your differential diagnoses between pseudoxanthoma elasticum, Marfan syndrome, and Ehlers-Danlos syndrome. Okay, concerning, because these three diagnoses, they share similar features, by the way, but there are some differentiating points, so you can choose or you can spot your diagnosis. For cases of Marfan's, you will enter inside and you will find the patient is very tall. But on the spot, you can diagnose the patient of Marfan syndrome. They are very tall. But in cases of pseudoxanthoma elasticum and Ehlers-Danlos syndrome, it's not necessary. They are having the average height. Okay? But sometimes in cases of pseudoxanthoma elasticum, okay, why it is called pseudoxanthoma elasticum? Because it is deposition like the xanthomatous deposition, especially on the lateral aspect of the neck. You will find like yellowish streaks on the lateral aspect of the neck. From the spot, you can find it. It is very easy. You can diagnose it. Okay. Let's come to our case, Ehlers-Danlos syndrome. Okay. If you suspect any case of hypermobility, your approach or your examination will be divided into two steps. Number one, you have to confirm the hypermobility, and number two, to approach the case and to pick up the findings, the positive findings in the case. I mean, first of all, you have to start with the patient's concern. This patient comes to you with right joint pain. Right knee pain, go and examine the knee joint. After that, you put in mind that this patient is having hyperelasticity. So, ask the patient to extend his thumb. I will send you now a picture how to tell the patient. Just a minute. Ask the patient to do this movement. Okay? This is number one. Number two, ask the patient to do this movement. This is a clear picture. As you can see, the thumb is hyperextensible. The little finger is hyperextensible. The elbow joint, in normal population, if you want to extend the elbow joint, it should be 180 degrees. But in cases of Ehlers-Danlos, it will be more than this. Also for the knee joint, you can see the knee joint is inverted to the back a little bit by 10 degrees. And after that, ask the patient to touch the ground by his palm while he is hyperextending his knee joints, as you can see here. This is to confirm the hypermobility. Okay? If examiners ask you what score do you use to grade or to score the hypermobility, it is called Beighton score. Beighton score. After that, go and examine the patient from top to toe. Let's start from top with the eyes. This patient told you that 1 month back I came to the eye doctor and he examined my eyes. The most common eye manifestation in cases of Ehlers-Danlos, you will find that they are having blue sclera. Okay, they are prone to have retinal detachment and retinal hemorrhage. And by the way, blue sclera is not a specific feature for Ehlers-Danlos. Osteogenesis imperfecta can have blue sclera. Ehlers-Danlos can have blue sclera. Marfan syndrome can have blue sclera. Pseudoxanthoma elasticum can have blue sclera. All of them, they share similar symptoms. Blue sclera is one of the shared signs. Okay, go down and ask the patient to do what you call it Gorlin's sign. Gorlin's sign. I will send it to you now. Gorlin's sign. Ask him to take out his tongue and to touch the tip of the nose. This is called Gorlin's sign. Where is it? Yes, this is it. Gorlin's sign. Ask him to take out his tongue and to touch the tip of his nose by his tongue. Okay, eyes. And in addition to that, they are more prone to have loss of teeth. Ask the patient to open his mouth and show me your teeth, please. Loss of teeth is a feature of Ehlers-Danlos syndrome. Ehlers-Danlos syndrome. Okay, let's go down. In the neck, ask the patient to extend the skin. You will find the skin like this. This is the skin of the patient with Ehlers-Danlos. It's very elastic. And it is very thin skin, in which sometimes you can see even the blood vessels beneath the skin. Okay? Let's go down. They are more prone to have spontaneous pneumothorax. Cardiovascular. Okay, Dr. Ghada, you examined for murmurs. Yes, they are more prone to have aortic regurgitation, so you are expecting to listen to early diastolic murmur, especially in the second aortic area. They are more prone to have mitral regurgitation, so systolic murmur in the apex could be listened. And they are more prone to have mitral valve prolapse, so you can see mid-systolic click or late systolic murmur. Okay? Let's go down. As much as they are having thinning of the skin, it is very important to tell the examiners, I want to examine the abdomen, especially looking for hernial orifices. Hernial orifices. As the skin becomes more elastic, hernia might produce and might protrude. So as the examiner, I want to examine the inguinal area looking for any evidence of hernia, inguinal hernia. Okay, when you go down to the knee, they are having a very specific and characteristic feature, especially in their knees. You can find it in other joints. It is called cigarette paper scar. Cigarette paper scar, like this, what is shown in the picture. Cigarette paper scar. It's more obvious in the knee joint. Cigarette paper scar. Okay. Going to down, they are more prone to have what you call it hallux valgus. Hallux valgus, like this. Deformity of the first toe, like this. Hallux valgus. Okay. Clear ya jama'a? The next issue, whenever they have any wound or anything, the wound usually heal with like this atrophic scar. So if you have time, just ask the patient, do you have any sites or any wounds? Can I have a look? You will find it like this, atrophic scar. They will heal, leaving atrophic scar. After that, you can finish your and ask the patient, what is your concern? What is happening with me? Okay, I really appreciate your concern. From what you told me, and after a quick examination, most likely you have a condition. So here you have to say most likely. Do not say you have a condition, because the definitive diagnosis is the genetic test, as I have told you. And because there are several hypermobility syndromes which share similar symptoms, but say most likely, after I examine you, most likely you have a condition called Ehlers-Danlos syndrome. Ehlers-Danlos syndrome are genetic diseases, or they are familial diseases, okay, which run in family. They are characterized by a defect or a problem in a protein. This protein called collagen, or you can say a problem in a substance inside your body, which is very important in maintaining your skin, which is called collagen. Actually, it can involve the skin and it can involve other organs as well. So for this reason, what we need to do now is to run some blood tests and to have some images as well. And if you find, for example, any murmurs like this patient, I will refer you to the heart doctor, and I'm going to do an image for your heart as well. I will refer you to the eye doctor to have another check for your eye as well. I will refer you to the teeth doctor to check your teeth if you found loss of teeth, for example. I will refer you to the joint doctor to have a look. What is the diagnosis of joint pain here? They are more prone to have osteoarthritis. These patients with hyperextensible joints. Okay? And that's all. If the examiner asks you, for example, how many variants of Ehlers-Danlos syndrome, there are more than 11 variants, by the way. And diagnosis is by genetic screening. And that's all. It is very important, ya Jama, if you have any case with joint pain, start with this. So at least you can narrow. Is there any laxity or hyperelasticity of the skin? Yes, no. Okay, no, go and ask about stiffness. Yes, stiffness or no stiffness. No stiffness, blah, 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 blah. No, yes, there is the stiffness, more than 1 hour or less than 1 hour. Okay, more than 1 hour, okay, 1, 2, 3, 4. Less than 1 hour, okay, 1, 2, 3, 4. By this, when you practice it daily by daily, you will master it. And inshallah, you will, all of us, I wish all of us, inshallah, all benefits, and all of us will pass the exam, inshallah. Any comments?
Yes, sir. I wanted to ask the sign the tongue will protrude and touch the tip of the nose. What's this name of the sign?
It is called Gorlin sign. I will send it in the chat box. Gorlin sign.
Okay.
So I have a question. What investigation we do to confirm the diagnosis of
genetic screening?
That is the only testing, sir. That's the only genetic testing. You don't test collagen, biopsy for lysyl hydroxylase deficiency. Do you do all those things?
Yes, you can do biopsy, but the definitive diagnosis is genetic. Okay, what if the examiner asks you what is the mode of inheritance?
Autosomal recessive.
Both autosomal recessive and dominant, by the way, both. Some variants they are autosomal dominant, and some variants are autosomal recessive. Okay, clear يا جماعة? Any questions?
والله بس كان قلت لنا بس التارجت هيستوري تاني بعد ما تعرف من الالاستيسيتي التارجت question about the case.
Okay, first of all, ask about the laxity of the joint. You will ask like this. Okay, okay. I'm Dr. Mursi, one of the doctors in the clinic today. Nice to meet you. Okay, Mr. Hatim, I'm here today to discuss some issues regarding your health status. Is that okay with you? Yes, okay, doctor. Okay, Mr. Hatim, it comes to my knowledge that you have been troubled with right knee pain. Am I right? He will say to you, yes. Okay, Mr. Hatim, may I ask you, have you noticed that your joint became more laxity than usual. Sometimes, what do you mean, doctor? Okay, have you noticed that your joint became more mobile than usual? I will say to you, yes, doctor, yes. Okay, next question. Have you noticed that your skin became more elastic than usual? He will say to you, yes, doctor. Okay, at this stage, you are targeting to wear either Marfan syndrome, pseudoxanthoma elasticum, and Ehlers-Danlos syndrome. Okay. If he tells you that, no, I haven't noticed. No, I haven't noticed that any elasticity of the skin. Okay, next question. Is there any stiffness or not? Either to you, either he will say, no, there is no stiffness, or he will say to you, yes, there is stiffness. Okay. Is there any stiffness? No, there is no stiffness. Okay, your differential now narrowed into mechanical, right, like osteoarthritis, infectious like septic arthritis, crystal induced like gout or pseudo gout, or trauma. And then after that, you can ask targeted questions. Okay, for example, if he tells you, no, there is no stiffness. Okay, like, is there any trauma? No. Okay, do you have any high temperature? Yes, doctor, I have high temperature. Okay, high temperature, no stiffness. This is most likely mechanical, so your differential diagnosis will be narrowed into septic arthritis, like this. Okay, like, for example, if he tells you, yes, doctor, I have noticed that I have stiffness. Okay, ask him, for how many hours do you notice this stiffness, or how many hours did it take to be relieved? Does it take to be relieved more than 1 hour or less than 1 hour? طبعا يا جماعة, this is not a rule, but this is the most likely, as I have said. If it is more than 1 hour, this is most likely seropositive arthropathies, like rheumatoid arthritis, like SLE, like Sjogren, like systemic sclerosis, polymyositis, like dermatomyositis. Okay, if it is less than 1 hour, this is most likely just syndrome, Bahcet's disease, or seronegative arthropathies. Mute يا جماعة, mute. Okay, and then after that, you can ask targeted questions. For example, if it is seronegative arthritis and the case is reactive arthritis, for example. Okay, do you have any problem in your vision? Yes, doctor. Okay. Do you have any problem with your water-wear burning sensation? Yes, doctor. Okay. Have you noticed, did you have any history of loose bowel, loose motion before? Okay. Yes, doctor. I have history of loose bowel motion just 1 month or 2 months ago. Like this targeted question. But this is the general points that you can narrow your differential diagnosis. Clear يا جماعة?
So I guess after this question,
I want to
take question for Ehlers-Danlos.
After you know this is hyper-elastic joints, or hypermobile, hyperlaxity joints, then I will go to differentiate between the three, Marfan and Ehlers.
Yes. In this case, what are you going to ask? Okay, you have to memorize. The features of Ehlers-Danlos. You know that Ehlers-Danlos is causing blue sclera, is causing retinal detachment, is causing retinal hemorrhage. Okay, do you have any problem with your vision? Number one, start from above to down, ya jama'a. Above to down. Do you have any problem with your vision? Yes. Okay, down. Have you ever had any problem with your teeth? Loss of teeth? Yes, doctor. Okay. Do you have any heart racing or any shortness of breath or any chest pain? Okay. Number 4, go down to the abdomen. Have you noticed that there are abnormal bulging inside your abdomen, especially inside your below your tummy, for example? Yes, doctor, I have noticed. This is inguinal hernia. Okay. Have you noticed that you have any joint pain other than the right side? No, doctor. Have you noticed that you have any deformity of your joint? Yes, doctor, he might show you this Hall's valgus. I have noticed this, doctor. Like this. If you know the features of each disease, you know how to ask, ya Jama'ah. There is no special rule. There is no special way. If you memorize the features of the disease, you can ask whatever you want.
Thank you, Dr. Muhammad. Just I would like to add a comment, if you don't mind. Number one, in the management, it's also important to mention about occupational therapist and genetic counseling. This mark in the exam is very important. If you encounter
Definitely. Definitely. Agree with you 100%.
Yes. And the second point in examination is very important to inspect. Just quickly, I mentioned if there is kyphoscoliosis or no kyphoscoliosis, because it's very important. If there's kyphoscoliosis.
Thank you very much, Dr. Ziad. I forgot it. Yes, it is very important to accept because they are more prone to have kyphoscoliosis. The patient might come to you with back pain. Thank you, Dr. Ziad.
Yes, that's all. Nice review. Thank you.
Thank you very much. Any questions?
Please, doctor, if you don't mind, we came late. If you don't mind, please you can share the record in the WhatsApp group. If you don't mind, because we are on duty and just now we join the session.
Recording.
Dr. Shahzad has recorded actually. He can upload.
Okay,
He will very talk on us.
Yes, because we came so late and just now we are joining the session.
Yes, sir.
No problem. We'll send it in the group.
Thank you so much.
Thank you, sir. Doctor, I have a question.
Yes.
I have a question. So, what are the features of this osteogenesis imperfecta? What will we see in osteogenesis imperfecta?
Again?
What are the specific features of osteogenesis imperfecta?
Yes, okay. طيب. Can we discuss this later, inshallah, because I have to go now.
Sure.
Okay.
Thank you so much.
Yes, I'm very interested actually in this Ehlers-Danlos mark.